Welcome to Toledo Clinic TV. I'm with Melinda Campbell. She is a certified nurse practitioner with Toledo Clinic. Thank you once again for joining us.
Absolutely, thanks for having me.
Let's talk about what it means to be a certified nurse practitioner. You have a lot of letters behind your name, but I want to focus on people maybe don't understand the difference between a nurse and a nurse practitioner.
Absolutely. So a registered nurse is someone who undergoes nursing school, gets accepted and goes through that roughly a 4-year program with graduating with a bachelor's degree. An APRN-CNP is an advanced certified practice registered nurse. So more or less as they go on to get their master's. So it's an additional roughly 2 to 3 years of schooling.
Okay. And that allows you to do what that's different than a nurse?
So I can prescribe, so I can send in prescriptions, I can order testing, I can diagnose, and in different states, like in the state of Ohio, if I wanted, I could open up my own practice, whereas versus like PA, they would need to work under a physician.
Okay, all right, that's important distinctions, yes. I think, and it's can be complicated.
Absolutely, and in the cancer realm, I can't order chemotherapy. That relies on the oncologist that places that order and provides the initial diagnosis and things like that.
Okay, so tell me why medicine?
So I actually used to want to be a meteorologist growing up, and then something when I became in high school, when I went to high school, I was like, you know what, I think I want to go more towards helping people. So nursing, I was like, do I do nursing, do I do doctor? I wanted to be a brain surgeon. Went to UT for 4 years, getting ready to talk about pre-med and all that, and I hated organic chemistry. So I went to my advisor, she was like, what do you want to do? I'm like, I don't want to do this. So I switched over to nursing. Got my associates. Then after I graduated with my associates, my mom passed. My mom got diagnosed with lung cancer. She unfortunately then passed away. She was actually a patient with the Toledo Clinic. She was stage 4, passed away at 49, and the late Dr. Bradley Sachs was her oncologist. And I just was like, I want to go back, I want to challenge. So after she passed away, I went back, got my bachelor's, practiced a little bit more as a nurse at St. Luke's, and then he was rounding in the hospital and he stopped and said, what are you doing? And I said, I was like, he asked how my dad was doing, and I said, I'm not really sure what I want to do with myself. He goes, I want you to come work for me. And I said, I don't know if I can do that. It's only been 3 months. And he goes, they're going to call you on Monday. So they called me Monday, had my interview Tuesday, got hired Thursday. I'll be there at 12 years. But then I was like, as an infusion nurse, I said, I want a little bit of a challenge. And they were like, go back to school. So I went back, got my master's, and now as a nurse practitioner with the Toledo Clinic. So they have a special place in my heart. And it's kind of like I continue to keep my mom's light alive, all while helping my patients, which is a huge reward.
And what is it that you think makes Toledo Clinic so special?
So it's individualized care close to home. And especially now we are partnered with the Taylor Automotive. It's going to be the research center where a lot of patients for clinical trials go out of town, like Cleveland Clinic and things like that, where they can stay close to home for potential clinical trials. And to the fact that somebody can go 5 minutes up the road to get treatment versus having to travel. We work with other practices, U of M. Our doctors talk to them all the time and say, hey, look, we're going to get your opinion. What do you think? So the patient feels some form of reassurance that, hey, look, everybody's on the same page and I can get my treatment close to home.
All right. So good to talk with you.
Yes, I appreciate it. Thank you.
Thank you.